Hello,
Hello, doctor.
I am Dr. Biswas. I am a doctor of this clinic. May I confirm your name and age, please?
Yes, doctor. I'm Paul Brandon, 33 years.
Nice to meet you. How can I address you?
You can call me Paul.
Okay, Mr. Paul, I have got a letter from your CP saying that you have runny nose for last 3 days. Is it right?
Yes, doctor.
Okay, I am going to take detailed history about your condition, and also during our conversation, I may take some notes. But all the information during our discussion will be remain confidential. So is that okay for you?
Yes, doctor. It's okay.
So can you please tell me in your own words what has happened to you?
Yes, doctor. Actually, for the last 3 days, I think that I have been having some runny nose, doctor, and I always have some problems with my cold. Sometimes I have some nasal stuffiness. Okay, so it comes and goes at times, but I never gave so much importance. I Someone told me that I have some problem with some sinuses, but recently during the 1 or 2 years, last 1 or 2 years, I think I have been facing this more and more frequently. Okay, so I am getting concerned, doctor. This time I have come to you that why these type of episodes come so frequently.
I'm sorry for your condition. Can you please tell me more about that? What do the do you feel during this condition? What symptoms you develop?
Well, doctor, actually, I think I have some nasal stuffiness, and at that times I have some mild raised temperature of the body as well. Sometimes I have these runny nose issues. Okay, so and sometimes I think I also have some issues with some runny nose, and sometimes I also have some chest pain as well, some mild chest pain and some cough as well. So at the different times, I face different types of symptoms, but mostly these are these chest symptoms come, doctor.
Okay, I'm sorry to hear that. And can you tell me that when did you first develop this symptom?
Doctor, this nasal stuffiness, doctor, I think that it started around when I was 22 years.
That is for around 10 years.
Yes, doctor.
How frequently do you develop this symptom?
Doctor, at the beginning, I think before the last 1 or 2 years, I had those symptoms very rarely, doctor, once or twice a year. So I didn't give any importance. But I think in the recent 2 or 3 years, or 1 or 2 years, I think I am facing this now much more frequently, doctor. I think around 5 to 6 times a year.
And when it starts, for how long it persists?
Oh, doctor, I think I have these type of problems for around 3 to 5 days.
And does it go on its own, or you need to take any medication?
Doctor, usually it goes on its own, doctor.
So you can
Usually it goes on its own.
goes on its own. Have you ever seek any medical attention for it?
But doctor, I went to the GP. They told me that I might have some sinus problems, and sometimes I took some antibiotics. I think when there was some nasal stuffiness, but nothing more, doctor.
Did you go undergo any imaging test or any other blood test?
Yeah, doctor, I took some imaging test, but it was actually quite okay, doctor.
Okay.
It was not. They didn't find anything significant, doctor.
And when it starts, for how long it persists? How many days?
Yes, doctor. Usually 3 to 5 days. I told you earlier.
Okay. And yeah, when you develop this symptom, you feel a runny nose, that is something coming out through your nose.
Yes, doctor. Runny nose, doctor.
Okay. Can you tell me that what comes out? Any blood or any?
No, 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 doctor. No blood, doctor. I think it's normal.
Okay. And you have feel also of nasal stuffiness, right?
Yes, doctor.
All the symptoms come simultaneously, or they come on and after, or differently?
Doctor, usually not all symptoms are present all time. Okay, sometimes I feel this headache with my some nasal stuffiness. Sometimes I have this runny nose. Once or twice I had some cough. I told you. So these are not fixed, doctor. Once I think there are different problems, different times.
Okay. Have you ever feel any soreness or pain when touching the area nose or around the nose?
Doctor, I couldn't notice like that, doctor.
And any have you noticed any changes in the shape of your nose?
No, doctor.
Any thing that coming through the mouth?
No, doctor.
Any changes in your vision? Any redness? Any itching?
No. No.
Okay. And you said that you have cough. Cough also for
Yes.
this time, or come when these symptoms develop?
Not all times. Sometimes, doctor. I told you.
Have you ever
Sometimes.
have you ever coughed out any blood?
No, doctor.
Have you produced any phlegm?
No.
All time
It's
it
mostly
right.
dry, doctor.
Okay.
Yeah, once or twice I think I have produced some phlegm, but it was not very much significant, doctor.
Okay. And along with you said that you have some chest pain. Can you show me that where do you feel the chest pain?
I think, doctor, it is very vague. Sometimes in the right part, sometimes in the left part.
Okay. And can you tell me that when do you feel the pain?
Doctor, I told you that all of them, nothing is present all the time. Okay, different times of symptoms at different times. Okay.
Okay. And have you noticed that anything that makes your runny nose worse or better?
No, doctor.
Any medication, any position, or changing your weather?
Well, doctor, nothing like that, doctor. But at times when I had these type of runny nose issues, I told you that my doctor prescribed me some antibiotics. They also prescribed me one or two tablets, doctor. But I think that tablets didn't work well. Rather, I think that when I took those top tablets, I think my condition actually got a bit worse. I don't know the reason, doctor.
Okay. And do you have any headache?
Sometimes, doctor, I told you that I had some sinus problems. At times, I have some headache, doctor.
For how long?
Yes, doctor, for around this 10 years, doctor.
Okay. And have you noticed any variation in the daytime of your headache?
No, doctor.
And where do you feel the headache?
Doctor, it is vague type of pain. I think more or less through the whole head.
Okay. Any morning type headache?
No, doctor.
Any changes in your vision?
No, doctor.
Any problem in your hearing?
No,
Any rash anywhere in your body?
no, doctor.
Have you ever developed this rash before?
Doctor, I think that I have sometimes I develop this some redness in my skin. Okay, but it goes away, doctor. And sometimes I think there is some itchiness in those parts, but it's not always present.
Can you describe more that where do you feel the redness or itchiness?
Doctor, sometimes in the hands, sometimes in my arms, legs. It's not specific, doctor.
And have you noticed anything brings that rash?
No, doctor.
It comes on its own. And when you develop these runny nose symptoms, or it can come other time also.
Mostly, doctor, when I have those runny nose problems.
Okay. And do you feel any itchy? What area?
Sometimes, doctor.
Any other skin changes like peeling out of skin or anything else?
No, doctor.
Any swelling?
No.
How about your appetite?
I think it's quite well.
And have you noticed any changes in your weight?
No, doctor.
Do you have any weather preferences?
No.
Do you feel any racing or pacing of your heart?
No, doctor.
Any shortness of breath?
No.
Any chest tightness or any whistling sound in your chest?
Sometimes I told you, doctor. At times I have some chest tightness. Sometimes.
And when the symptoms runny nose arises?
Yeah. Yeah.
And do you have any tummy pain?
Doctor. Very rarely, doctor. I have some tummy pain as well.
Where do you
It's
feel
not.
the pain?
It's not. I think all over the tummy, doctor.
Does it
Sometimes.
goes back?
No, it doesn't go to anywhere else, doctor. It
Uh,
it
does it have any
it
relation
goes
with?
away on its own.
Does it have any relation with food?
I haven't felt so, doctor.
Okay, no problem. And can you tell me that do you have any problem with your bowel work?
No, doctor. I haven't. Sometimes, doctor, I feel that I have some loose motion. Sometimes, but it's very rare, doctor. It's. I think it's almost same, doctor.
Have you ever noticed any blood or black stool?
No, doctor, never.
How about your water work?
Quite well, doctor.
Okay. Any weakness at any side of your body?
Oh yes, doctor. That's another issue actually. I think I had there were two times actually I had some this type of problems, doctor. I think one time I had some weakness in the left part of my hand. Again, another time in the right part.
And did you seek any medical attention for that?
No, doctor, it actually went away at a very short time, so I didn't seek any specific attention.
Did you feel weakness or just numbness or abnormal sensation?
I think that there was some weakness, doctor.
Oh. Did you ever lost consciousness?
No,
Do you feel any dizziness when standing from the sitting position?
no, doctor.
Any? Do you have any joint pain?
No, not yes, doctor. I have some joint pain, doctor,
Where do you feel the
but
pain?
not now, doctor. I had it.
Where did you feel the pain?
Yes, doctor. I think it's more in my hands. Okay.
And when do you feel the pain more, at night or in the daytime?
Doctor, I think it's more or less same, doctor, when it comes.
And do you feel any morning jamming when it comes?
Doctor, not for a very long time.
Have you noticed anything that worsen your condition, like resting or working?
No, doctor, I haven't noticed, doctor.
Okay, no.
There's just some pain, sometimes some pain.
Okay, no problem
Okay.
with that.
Uh, oh,
And can you tell me that do you have any past medical condition like asthma or anything else?
doctor, I told you that I had some this chest tightness issues for the last 10, 12 years. That's all, doctor.
And may I know that do you take any medicine or any drugs?
Doctor, I told you that at times I had some antibiotics, and once for this chest issues, I was prescribed a tablet. I cannot name it properly, but after taking that, I got worse, doctor. So now I don't take it.
Sorry for that. And can you tell me that do you take any over-the-counter medication or any herbal products?
No, doctor.
Do you have any allergy to any medication?
No,
Do you have any allergy to any food or any other particles?
no,
Okay. And may I know that any of your family members have this type of condition?
no. I don't know of it, doctor.
Any disease that runs in your family?
No.
And is it okay if I ask you a few personal question?
Yes.
Do you smoke cigarette?
Yes, doctor.
I would like to recommend you stopping smoking because this is also related to your condition. And if you need help, I can refer you to the smoking cessation clinic. Will it be okay?
Yes, doctor. It will be all right.
Okay. And do you drink alcohol?
No, doctor.
Okay, that's fine. I know that what do you do for living?
Doctor, I'm a journalist, doctor.
And, do you think that you need any social support or any economical support from us?
No, doctor. I think it's quite well.
And may I know that whom do you live with?
Well, I live with my wife, doctor.
And is she supporting enough?
Yes, yes.
Okay, that's good. And I am going to ask you a very personal question that do you use any blood products or any injection through your blood channel?
No, doctor.
Is it okay if I ask you a very personal question about your sexual life?
Yes, doctor. No problem.
And, do you have any casual relationship or casual partners?
No, doctor. No.
Yes. And may I know that do you drive?
Yes, doctor.
And for that, I would like to recommend you to stopping driving until we are sure that what is happening with you. Okay.
Okay, doctor.
So is it okay if I examine you now?
Yes, doctor. Please.
First, I'm going to see the general look if it is malnourished or not.
No, it's normal.
Then I am going to examine the hands for clubbing,
No clubbing.
any rash.
No rash at the present. At present.
Okay, and then I would like to examine the pulse.
Regular 72 beats per minute.
Then I would like to examine the eyes for any redness.
No redness.
Then I would like to see the mouth for any ulcer or rash.
No rash present. No.
I would like to auscultate the lung for any reduced breath sound or any crepitation or any wheezing, and also
Some
breath
we
sound,
scattered wheezes present.
scattered wheezes, no crepitation,
No.
no reduced percussion, or no reduced breath sound.
No.
And breath sound is vesicular or vesicular prolonged expression.
Vesicular.
Okay, then I would like to tap over the lung for any dullness.
No, it's a normal resonance.
After that, I would like to examine the nose for any nasal blockage or any foreign particles or any signs of inflammation, any granuloma.
I think some nasal stuffiness is present, doctor, and some you can I think some watery part can also be looked through the nose.
Okay. And after that, I would like to see the plantar reflex,
It's normal.
and I would like to see the sensation over left and right side.
Okay, it's normal now.
Can you show me how you walk?
This walking is quite okay, doctor.
At this point, may I know that what is your concern?
Doctor, actually, what is going on with me, doctor? I'm a bit worried now.
Yeah, I need to be sure by doing some blood test and some imaging test. And as far as I've taken your history and examined you, it seems likely to me that you are suffering from a condition called eosinophilic granulomatosis. But we need to be sure by doing some blood test and some imaging test. Do you have any idea about this disease?
No, doctor.
Yeah,
What's this?
actually, in this condition, a blood products is increased in our body so much they are causing your coughing symptoms. They are causing your chest tightness and also runny nose and also some rash on your body and weakness that you have suffered previously.
Okay.
I am going to
And is it serious, doctor?
actually it can be remained under control time up.
Okay. Okay. So, what do you think your diagnosis is?
For this gentleman, my first diagnosis is this is can be a case of eosinophilic granulomatosis. And apart from that, I will also consider other causes of vasculitis like uh, uh, Wigner's granulomatosis. Then I'm also considering polyarteritis nodosa. Then I will also consider other conditions like
Hello.
Yes, I forgot actually.
Okay, that's all right. But actually, eosinophilic granulomatous is okay. And okay. And, what investigations would you like to do?
For this, I will first go for the uh, uh, routine blood investigations like complete blood count to see anemia and see white blood cell count level, then inflammatory markers, CSR and CRP.
Okay. Hello.
Yes. And after that, I will go for the liver function test, renal function test, random blood sugar level, urine for routine examination, and some special investigations like CA analysis level,
Mm.
and then anti-nuclear antibody level, and
Yes.
also
Yes.
some imaging test like X-ray, PNS, OM then chest X-ray. Then I may also go for some biopsy of through on the nasal mucosa, or also if anything suspicious, then I can go for the biopsy, in the bronchial biopsy.
Okay. Yes.
This is
And
what I can remember.
okay, actually, that's all right. Well, would you like to do some? Well, I think you have done quite well, but can you please specify that I told you that there was one medication that actually made it worse? Can you tell me which medication could it be?
Okay, for eosinophilic granulomatosis, some medications can worsen it. Actually, I forgot at this point.
Yes, yes.
Like,
Actually, it's Montelukast. Okay,
yes.
I told you that there was some medication that was given for this, and it actually made it worse. So Montelukast can make it worse, Church-Strauss disease or eosinophilic granulomatosis. Okay, so what do you think should be the treatment in this patient?
Actually, first in educating and counseling the patient, then involvement of the multidisciplinary team with involvement of the rheumatologist, involvement of the respiratory physician, and then involvement of the physiotherapist, involvement of the social care department, and also involvement of the neurologist.
Okay. And do you think that is there any specific medications that can be given?
There are certain immunosuppressive medication that can help in this condition, like steroid, then cyclophosphamide.
Yes, yes. Okay. Oh, that's all right. And well, I think you have done really well. But uh, I think I don't think there are many things to be added in this case. But if there was any racing and pacing present, could you think of any other diabetes?
At that time,
Any-
arthritis should be a differential also.
Yes, arthritis could be, and uh, at that time, eosinophilic pneumonia, actually, log brain syndrome, that can also be a DD. Okay,
Okay.
because in that case, there can be some, I think, there can be some cardiomyopathy can also be present eosinophilic presentation. Okay, when there is very high eosinophil count, it can also involve the heart. Okay, some dilated cardiomyopathy, I think that can also be present. Okay, so do you want to add anything?
No.
Okay, I think that's all for this case.